We all go through ups and downs in life, but when life struggles get too unbearable, depression can set in. When typical medications don't work, people often turn to alternative treatments. Some patients are using a magnet to relieve their pain, while others are turning to a street drug for help. Joey Corbin has suffered from depression for more than a decade. 5 different medications didn't help. Life seemed hopeless until he tried transcranial magnetic stimulation.
The TMS was my last alternative to dealing with the depression. If it wasn't this, then it was nothing.
Well, it was your last resort, and what are your results?
Oh, they're great. About a week and a half when I started seeing the results of sleeping better. About 3 to 4 weeks when everything really started coming back, and I didn't even realize what all I lost.
That's huge, isn't it?
Oh, it's great.
No more medications?
No more medications.
Well, we want Dr. Cress to kind of show us how this works.
I'm just going to make sure that Joey got everything lined up.
How in the world does a magnetic therapy help?
And encased here is an MRI strength magnet. Has energy of what they call 1.5 Tesla. And that magnetic field pulses on and off over a 30-minute period of time. And so within that treatment, individuals will feel a slight pulsing sensation.
And when you say MRI, people might wonder about radiation.
Right, magnetic field, not radiation.
Right.
Actually, when individuals typically go through a 20 to 30 course treatment, actually the amount of exposure they have is less than 1 body MRI. So the safety that we know in regards to use of MRIs is well known and well established, so quite safe, even for pregnant women.
You can hear the magnet pulsing.
The magnetic field that it creates actually stimulates electrical current. When it creates electrical current, then neurotransmitters, what we call chemicals, serotonin, norepinephrine, dopamine, are released in the brain directly.
Gail Oburn has also benefited from the treatment. She was Dr. Cress's first patient here at the Serenity Center for Depression in Sugar Land.
My mood is very, very different. I do things, I plan a day. I just don't sit there and wait for something to happen. I make things happen.
You suffered from depression for a very long time, haven't you?
Yes.
Medications just weren't working for you?
Medications worked for a while, but things would always go backwards.
But Gail says not anymore. Treatments usually last 5 days a week from 4 to 6 weeks. Dr. Sanjay Matthew at Baylor College of Medicine is the lead investigator of another type of treatment for depression. Hard to believe, but ketamine, known on the streets as Special K or Cat Valium, may be the answer for extreme cases of depression.
Commonly administered for sedation for orthopedic procedures or other procedures, and it's also a drug that's been a drug of abuse in that often adolescents or college students have used ketamine inappropriately.
Kids have been known to break into vets' offices to get a hold of it.
It makes them feel lighter. It makes them feel a sense of temporarily high. Many kids who've abused ketamine have said it makes them less depressed.
Which is very interesting because now you're studying it to see if it can help depression?
Yeah, so we're studying it in a very controlled manner in a dose that's about 1/4 to 1/6 the dose they use in anesthesia.
Dr. Matthews says the treatment will be given through an IV and is showing to quickly turn around extreme cases of depression when nothing else works. It's already FDA approved for other reasons, so it could be administered now, but he thinks it will become more commonly used in a few months. Treatment we showed you lasts about 40 minutes, and patients can drive themselves and go back to their typical routine right after the procedure. Some health insurance companies do cover the cost of that treatment.